joining us for today's edition of Mercy Health Chats. Today, we have Dr. Gregory Boone, a general surgeon at Mercy Medical Center who performs many breast cancer surgeries each year. He will be discussing the latest in the fight against breast cancer, including warning signs, current treatment options, the importance of routine breast cancer screenings, and the most recent research in breast cancer. Dr. Boone is a graduate of Wright State University's Boone Schaft School of Medicine and completed his general surgery residency training at Mount Carmel Medical Center. He's certified by the American Board of Surgery and has more than 30 years of experience in general surgery. As a prostate cancer survivor himself, Dr. Boone feels that this experience has made him an even better doctor for his patients. Dr. Boone has also been instrumental in serving as Mercy Medical Center's Real Men Wear Pink campaign chairperson in the past, raising money for the American Cancer Society's mission in the fight against breast cancer. If you have any questions during the health talk, please feel free to ask your questions in the comments section, and Dr. Boone will be more than happy to answer all of your questions. Dr. Boone, before we get into the actual topic today, could you tell us a little bit about Mercy's Breast Care Center and maybe even a little bit about Mercy Surgical Specialists?
Sure. So our Breast Care Center is more than just a physical place where women come to get their mammograms and diagnostic studies if they need them. It's actually a group of people who work together to assure that we're providing the very best in care and the latest in care for patients with breast disease. And that care team includes many people, not just surgeons like myself, but radiologists, medical oncologists, radiation oncologists, pathologists, plastic surgeons, our medical team, and perhaps most important, our great nursing staff, our nurse navigators who help patients deal with getting through the system and then help with the recovery that goes into a diagnosis of cancer.
Oh, okay, that's wonderful. So tell us a little bit about Mercy Surgical Specialists, which is where you practice.
Yeah, Mercy Surgical Specialists is a group of general surgeons. All of us have different strengths and different areas of expertise and interest. We have a couple of surgeons who have colorectal specialty training. I've spent my entire career focused on breast cancer care. We have some young surgeons who are new and out of training and really interested in some robotic surgeries and things along those lines. So we really have a broad range of expertise and interest in our practice group.
Perfect. That sounds wonderful. Talking about breast cancer, what are the warning signs for some of our viewers who don't know? And are there some warning signs that are hard to detect for women?
Well, it's certainly not always easy, but one of the things that we emphasize to ladies is to try to perform self-exams on a regular basis. This doesn't change whether you get or you don't get breast cancer, but the idea is to try to find things as early as possible. And there's certainly evidence that women who do monthly self-exams find tumors that are smaller than women who don't do self-exams. So, you know, we always encourage those self-exams in adult women. They're looking for new lumps in the breasts that feel different than they felt in prior exams, which of course is the importance of doing them regularly because you get used to what things feel like in your own breast because it's different for everyone. So we're looking for lumps. We're looking for redness or scaliness of the skin. We're looking for dimpling in of the skin or pulling in of the nipple or drainage from the nipple that could be unusual and could mean something important. Mm-hmm. So any of those kinds of signs, if you're examining yourself, should be brought to the attention of your doctor.
Okay, perfect. You mentioned just a little bit about mammograms. How important are mammograms for women over 40?
Well, in my opinion, they're very important. You know, in the last number of years, there's been some controversy about how frequently women should get mammograms, but I think most of us who do breast cancer care and breast surgery really feel that women 40 years and older should get routine yearly mammograms. And the benefit behind that is that not everything can be felt or seen on self-exams or physician exams. So we're looking for early cancers. That's the idea behind mammographic screening. We want to find things at the earliest possible stage, if possible, before tumors become invasive, meaning having the potential to spread to other places. If we can find tumors that are early, even non-invasive tumors, then our cure rates go way up. So mammograms, I think, are terribly important.
Okay. Wonderful. And just as a reminder to our viewers, if you have any questions for Dr. Boone during this health talk, please feel free to leave your questions in the comments and he'll be sure to answer. All right, since we're talking about the screenings, at what age should women begin the monthly self-breast exams? And do these replace mammograms?
Well, it certainly doesn't replace mammograms, but for young women, you know, who are younger than 40, generally we're not going to be doing mammograms. So self-exam is really, I think, important because although it's not typical, young women do get breast cancer. And so since they're not getting mammographic screening, I think it's even more important perhaps to do self-exams. I don't know that there's a magic age. I think when women start menstruating, and that's sometimes young and have breasts, they probably ought to have someone talking to them about, you know, as part of your general health, you should check your breasts on a regular basis.
All right. Are there gene mutations that would increase a woman's risk of breast cancer?
Yeah, so there are some gene mutations that do indeed increase your risk for breast cancer. The things that most people know about these days are the BRCA1 and 2 genes, but since discovering those genes a number of years ago, there have been many, many more genes that have been identified that are related to breast cancer. Not everybody has these, not everybody should get tested for this, but there are certain people who should. If you have a mother or a sister or a daughter who has had breast cancer, particularly if they've been diagnosed at a young age, younger than 50, then certainly that's someone who would be at risk for having a genetic mutation. And actually that person should be tested. And if they are positive for a genetic abnormality, then their relatives need to be tested. So there are some things that trigger you to think this is a person who's at higher risk than the average person for having a genetic mutation. But the truth is we still have not been able to pinpoint the cause for breast cancer in most women. Most women don't have a genetic abnormality.
Okay, that's great to know. And I didn't even realize, aside from the BRCA1 and 2, that there have been all these other gene mutations out there. So that's really good to know, and for our viewers to understand that those are out there as well.
Yes, and it's changing every day. We're learning more and they're discovering more genes. So I think this is something that is going to evolve as time goes by. We're going to learn more. So it's really important to know who might be at risk for that and who needs to be studied.
Okay, perfect. Aside from gene mutations, what are some other risk factors that would increase a woman's risk of getting breast cancer?
Sure. Well, being a woman is the most important risk factor, and I think it is important to emphasize that men get breast cancer too. So this talk applies to men as well in many ways. Men don't get mammograms and things like that because breast cancer is so much more common in women, and that's because of some hormonal things. But men do get breast cancer, so if you're a man and you feel a lump in your breast, for goodness sakes, please don't ignore that. Get checked, make sure that it's okay. So just a sidebar there. But as far as risk factors for women, age is the biggest risk factor. So as one ages, the risk factor for breast cancer increases. So getting old is a risk factor for breast cancer. Women who've never had children or have children later in life, they have a higher risk for breast cancer than women who have never had, women who have had children. Women who are on hormone replacements for long periods of time may have some increased risk, so we sort of discourage long-term use of estrogen hormones. So those are some of the things that are also at risk. And then, of course, the family history issues that we've talked about before.
Okay, perfect. For women who, have not been diagnosed with breast cancer, they may not understand the treatment options that are out there. So what are the current treatment options, surgical procedures, therapies? What currently is out there to treat breast cancer?
Sure. Well, fortunately, there are lots of treatments available for breast cancer. So depending on your particular cancer and its characteristics, how big it is, and things like that, surgery is generally thought of as the first treatment for breast cancer, and there are certainly options. Not everyone who has breast cancer needs to lose their breast. Now, there are some circumstances in which mastectomy is the only reasonable option, but many, many women have the option to keep their breast and have a procedure that's commonly called lumpectomy. That procedure is often combined with radiation therapy, so there's where our radiation oncologists come into play. As far as treatments above and beyond surgery, there are just many, many, many options for treatment. Lots of ladies after their breast cancer surgical treatment are taking hormone blocking pills if their tumor is responsive to those kinds of therapies. Some women do need chemotherapy, but we've really come a long way in being able to tailor that and identify who really needs chemotherapy and who doesn't need chemotherapy. So we treated many, many more women than we do now with chemotherapies. Lots of those, unfortunately, in the past unnecessarily. Now we can really tailor who gets that kind of treatment based on actually some of the DNA and molecular makeup of the tumor. So it's become pretty sophisticated today how we decide what kinds of treatments that we use. And in addition to standard chemotherapies and hormone blocking drugs, we also have newer treatments which are called immunotherapy. These are things that are targeted at certain factors that some tumors have, that we can use these drugs to attack those things on the surface of those cells. So we really have a lot of options for treating breast cancer today.
Oh, that's so wonderful to hear. I know our viewers and a lot of women, they just assume a breast care diagnosis is like, immediate chemotherapy, and then they worry about things. So I think it's wonderful to hear that there's so many other options out there and that you've come such a long way.
Yeah, and again, this is why our breast care team is so important. This isn't just a surgical problem. This isn't just a medical problem. This is something that we really need a multidisciplinary team. So we need all of those people to help us treat patients in the best possible way.
That's wonderful. What do you see on the horizon, or do you see anything on the horizon for breast cancer treatment or surgery?
Well, I mean, the good news about breast cancer care is it really is one of those diseases that gets a lot of attention and gets a lot of funding, and as it should, because it's so very common. So there are always new treatments on the horizon, new therapies, new drugs. It seems like there aren't many days that go by that we don't hear about something new that's come to be able to treat these diseases. I mean, 10 years ago, these immunotherapies, those targeted therapies that I talked about, basically didn't exist. We've advanced surgical treatments. When I started, everybody who had a breast lump or who had an abnormality in their mammogram went to the operating room and had a fairly significant operation to get a diagnosis. Now we do needle biopsies. So things are changing every single day with breast cancer care, and advances are being made every day.
That's wonderful. Now, I understand that you are a prostate cancer survivor yourself, and that you feel that that experience has made you an even better doctor. Can you tell us a little bit about your cancer journey and why you feel it made you an even better doctor for your patients?
Sure. 19 years ago, I was diagnosed at the age of 43 with prostate cancer, which of course no one who's 43 years old expects to have, but there you go, I had it. And it certainly has made me a better doctor. It's made me a better everything. I'm a better father and husband and just a better person because of it. But even though I thought I understood and I thought I related and empathized with my patients, having this personal experience really helped me to understand how life-altering a cancer diagnosis is. It changes everything. I understand what it's like to have a big operation and have to recover from that. I understand the fear that comes with a cancer diagnosis. And so it certainly made me be able to understand and empathize with my patients better. And I got to tell you, my patients saved my life. I really struggled emotionally with my diagnosis early on, and finally had a friend who said, you know, you have to talk about this. And the people that I chose to talk about it with were my breast cancer patients. And by talking about it, it helped me to get rid of the fear that I had. And it also really opened a door for patients to be able to share what fears they had and what concerns they had. So it's just really been a blessing for my practice to have had my patients that could help me. I owe them so much more than they owe me, that's for sure. And I think when you tell your patient, I know what it's like to sit in your chair, I've sat there too, it really helps that relationship that's so important to being able to take care of someone and help them through this cancer journey.
Okay, that's wonderful, and that's a wonderful story, and I'm sure, like you said, just you opening up to your patients just opens that door for them to feel more comfortable in sharing with you. So
I certainly hope so, yeah.
Yeah. Is there anything you would like to add, you know, for our viewers, or maybe some of our viewers have never done a self-exam, never got a mammogram, and maybe they're a little afraid to start the process? You know, what advice would you give them? What else would you add?
Well, it is scary to venture into the unknown, and when you get that first mammogram, you don't know what it's going to show, and you're afraid that it might show something, or you're afraid if you check yourself you might find something. But what I would say is that knowledge is power. You know, if you know what's going on, you can take control of it and you can deal with it. So it's hard, but overcoming that anxiety and that fear of doing that first self-exams, getting that first mammogram, I think is really important, because if you have knowledge, then you have power and you can deal with it. And I would also just say that breast cancer, while scary, is something that we have really, really come a long way with. We cure most women diagnosed with breast cancer. Even women who have advanced stage breast cancer, we can treat you and give you a long life in many, many cases, and a good life. So it is certainly a disease which has come a long way, and there is great, great hope for the future. So I think we're making great progress, and we're going to continue to do that.
That's wonderful. Well, thank you so much for being with us, Dr. Boone, and thank you for sharing your knowledge and hopefully comforting some of our viewers out there that maybe are afraid to take that path and get that knowledge. So thank you so much for sharing with us today.
You're welcome. I appreciate your having me.
Wonderful. Just a reminder, if you have any questions for Dr. Boone that have not been addressed during this health talk, please feel free to put your questions in the comment section below, and he'll be happy to answer that. To learn more about Mercy's Breast Care Center, you can call 330-489-1493, or you can visit cantonmercy.org/breast-care-center for more information. To learn more about Mercy Surgical Specialists, where Dr. Boone practices, please call 330-580-4706.